Welcome. Good evening, everyone. My name is Natalie O'Rourke. I'm the Executive Director of the Texas Oncology Foundation, and we are thankful to have you all join today. For those who don't know about the foundation, we are dedicated to providing support to cancer patients and caregivers in the communities where they live, work, and receive treatment. One of the ways that we do that is through the Survive and Thrive programming, which includes webinars and symposiums. So we're thankful that you joined this month. Please check us out online at texasoncologyfoundation.org to see where the nearest symposium will be if you would like to attend. And also, Kelly, our program coordinator, will share with you at the end of this webinar next month's topic. So I want to thank you all for attending, and also introduce Sabrina Mikan. She is Director for Supportive Care Programming with Texas Oncology, and she's going to lead our discussion today around survivorship care planning. Before we get started, I do want to make just a few mentions, and one of them is we are excited to have Mount Pleasant and Tyler hosting watch parties today at their practice. So thank you for gathering, and we hope that you enjoy this. We are going to do a few icebreakers today. So the first one, I would like to know how many of you have attended a Survive and Thrive symposium or webinar before? Great. And then a second poll question for you is, help us count audience members. How many of you are viewing this webinar from your location? All right. Well, I'm going to thank you all for taking the time to answer those poll questions. So I'm going to hand this over to Kelly Condon. She's our program coordinator with the foundation, and she's going to go over some housekeeping announcements.
Hi, everybody. Like Natalie said, my name is Kelly Condon. And just before we get started, I just want to make sure everybody kind of knows a little bit about our go-to webinar that we are on right now. If you have questions, please feel free to submit these at any time during the webinar. On the right side of your screen, there's a control panel and there's a questions tab. If you are viewing along with others at your site, please designate a scribe to submit the questions for your group. We plan to respond to questions after the presentation, so please keep them coming. Secondly, if you are experiencing any trouble, most of the time closing and reopening the webinar window will usually fix all viewing issues. If you're having audio problems, the best solution is to call into this webinar and listen from your phone. Again, on your control panel, there's an audio section, and just by selecting phone call, the access number and all the information you need will pop up. Throughout the presentation, we will be having some poll questions, and just like we practiced just a few minutes ago, these polls will show up on your screen and you can select your answer and we will get your answers that way. Lastly, there are handouts available to you on your control panel. Under the handouts tab, there are 3 separate handouts on this presentation, and you can open those and download those at any time. This webinar is being recorded, so for some reason you are unable to hear the entire presentation, or if you would like to share it, you will receive a follow-up email after this with a link to the recording, and it will also be on our Texas Oncology Foundation website. All right, so once again, I just want to thank Dr. Mikan for being with us today. Like Natalie said, she is a clinical nurse specialist and coordinates supportive care programs for Texas Oncology. I've had the opportunity, as she is a speaker at multiple of our Survive and Thrive symposiums around the state, to hear her, and every time she presents, it is just so clear that she has a love for her patients and a love for the care that she is providing them. So Dr. Mikan, I am going to give it over to you and take it away.
Wonderful. Good afternoon. I hope everyone can hear me all right. And I too have, right at the beginning, some icebreaker questions. As it is 4:30 in the afternoon, I wanted to kind of get us going and get us ready for talking about how to create your care plan. So let's go ahead and try some of these questions here. How energized are you feeling right now? Excellent. I think if I can see here, we've got about 53% of you are feeling pretty good, in the middle, which would be just totally appropriate for this time of day. I'm so grateful that you all have made time for me this afternoon. And let's go to the next question here. So which superpower would you like to have? Oh, I love it. So many of you wish you had mind reading. I wonder what that would be for all of us if we had that opportunity. Great, great. You're making me smile. I hope you're smiling lots. And we'll go to the next question, which is just, again, me wanting to kind of see who's joining us. Survivors, caregivers, friends, family, and so forth. Healthcare providers. This is awesome. So 70% survivors, 5% caregivers. We've got some friends and families, and then we also have some healthcare providers on, which is great. Perfect. So thank you so much for joining me. As I've said a few times already, but it is my pleasure to present some of this information today to you. What I have on our screen here is the objectives. So these were kind of my few goals for today. I really wanted to describe to you survivorship care plans. What are they? I wanted to discuss the importance of post-treatment care plans for you, but then also for your healthcare teams. So primary care providers, other docs who are involved in your care, and also to learn to teach you how to create your own survivorship care plan using an evidence-based care planning program. So first, at the beginning, there's many different definitions out there of survivorship. Here are a few. I tend to, when I present anything via in-person or via webinar, I don't read everything on the screen because I know that you all are very, very smart and can also read them. But for sure, when we think about cancer survivorship, it definitely means living with, through, and beyond cancer. Really, when we think about this definition, it begins at diagnosis and includes people who continue to have treatment over the long term to either reduce the risk of recurrence or to manage a chronic disease. There are 3 phases of survivorship when we also really get into the nitty-gritty. One would be the acute survivorship phase. This begins at diagnosis and goes all the way through the initial treatment plan. So you have finished, be it surgery, chemotherapies, immunotherapies, and radiation. The extended survivorship phase, that begins at the end of initial cancer treatment and goes through the months after. So this is essentially where it is a really good time to be thinking about your survivorship follow-up care. When we also think about creating care plans, this is where when we finish treatment, we wouldn't want to do our care plan a week later. Typically, we want to do it within 6 to 9 weeks after we have finished our chemotherapies, immunotherapies, or radiation, because we want to kind of see what are some of the effects of cancer and the treatment. That tends to be our focus. And then permanent survivorship, that is the last phase of survivorship, and that really is the period when years have passed since the cancer treatment was provided and ended, and recurrence seems less likely. So our survivorship care plans, there's a lot of history about care plans over the years. It really did begin back in 2005 when the Institute of Medicine created and held a symposium. In this report, they recommended that every cancer patient receive an individualized survivorship care plan. What they really also recommended was that any patient completing primary treatment should be provided with this comprehensive plan summary and also discuss with them the follow-up care. We really want that to be clear and effectively explained. And in many cases, this is provided by a physician, by an advanced practice provider like a nurse practitioner, CNS, or physician's assistant, and also in some cases, registered nurses. It says here how survivorship care plans are meant to help improve the quality of care of survivors as they move beyond their cancer treatment. What should survivorship care plans have in them? Again, what you'll see today when we create one from the patient's perspective, we want to make sure that we have prevention and detection of new cancers information in there. We also want to talk about surveillance for recurrence. We want to discuss how we'll monitor, how we'll manage any kind of psychosocial or medical late effects. We want to discuss providing screening recommendations for second cancers. Also, very important is providing health education, so kind of the basics of health promotion. Everything related to kind of what was this diagnosis all about, what was the treatment all about, and then now let me help kind of guide you on any of the pieces that you need regarding diet, exercise, and like I said, health promotion. We also have, of course, this interventions for long and late term side effects. So over the course of be it that first 3-month follow-up visit that you have with your physician or advanced practice provider, or 3 months from then, your 6th month and so forth. Really, how are things going? Are you noticing any particular late or long-term side effects? And then, of course, coordination between specialists and primary care providers. We really want to make sure that as we've been holding your hand during this entire time, all these months, all these weeks, now that things are finished, we're also talking about our new relationship moving forward. You will be wanting to get connected back to your primary care doctor, back to any of the other physicians that you were really seeing from time to time. Generally, of course, if you have specialists like cardiologists, endocrinologists, and so forth, we usually want you to, of course, keep those appointments going throughout your cancer treatment so that they're coordinating that piece. But this is our Texas Oncology program, essentially. So Empowering Wellness is a one-on-one visit with an advanced practice provider or a registered nurse. It is 1 hour in length. And in many cases during that visit, you would receive many details. Again, we're going to go through this through the survivorship care plan, but there might even be more of a focused discussion. Anything related to cancer type, tumor characteristics, the treatments that you received, this includes surgical, radiation, and so forth. We also will focus on what does the roadmap ahead look like for your oncology care with us. How often will we see you? How will you learn about, surveillance and how we'll monitor this? And then, of course, the psychosocial pieces and just staying in touch with your oncology care team. And I've said this phrase a few times now, psychosocial oncology care. It's been around for over 30 years. It's definitely a very well-established area of oncology care. It is something, as it says here, it is a specialty in cancer care concerned with understanding and treating the social, psychological, emotional, spiritual, quality of life, and functional aspects of cancer from prevention through bereavement. We really know that at the end of active treatment, kind of a patient's safety net of regular, frequent contact with us as the oncology healthcare team, that does change. We don't want patients to feel alone or isolated. And sometimes, even as we do stay in touch over a few months and so forth, survivors, we they may experience uncertainty about the future. Sometimes there's loss of your usual support from friends or family. Sometimes people experience increased anxiety. There is sometimes the fear of recurrence. That's why I've included one of the handouts today addressing some of that. Sometimes there could be a physical, psychological, sexual, any kind of problems. that could lead to relationship struggles. And in a way, as I have on here, returning back to work, that is a really big piece in relation to how we took this time for our health, some people working part-time, some people taking family medical leave and so forth, but how do we get back to it? So through each of the slides, and these two in particular, I will in a moment show you these websites. In general, there are several resources out there, but I do really like both of these. Both Cancer Support Communities has an excellent program called Cancer Transitions, and then Cancer and Careers also has some good information for even people who are newly diagnosed, how to talk with your manager about this. And we'll jump into using Oncolife's through Oncolink's Survivorship Care Planning Program in a minute. I wanted to briefly describe how Oncolife's Survivorship Care Planning Program, as it says, is endorsed by ASCO and Livestrong. It's been around for several years, and it definitely provides evidence-based, very thorough evidence-based information so that as you go through it, some people might be going through it as I'm showing you today to create your own. I think that that would be awesome. You can complete it. You can print it out. You could, of course, as you read through the information, since it is so thorough and it is such good information, it's nothing that I'll be able to cover line by line with you today. But in a way, it really does help that if you come across questions about what you've been noticing about your body, any changes post-treatment and so forth, reaching out to your physicians, your oncology care team. So I'm going to just transition to the website. Before I do that, I did pull up some of the resources that I had the links to in the presentation if you're wanting to read more about cancer survivorship pieces. We have, of course, ASCO. We have the American Cancer Society. We also have here, if you wanted to read From Cancer Patient to Cancer Survivor, Lost in Transition, you can download the book for free as a PDF. And then, as I was discussing earlier, some of those key components of survivorship care, really what is necessary to be addressed to meet those needs. And then our specific area of survivorship on our Texas Oncology website, basics information there, again, about the program and reaching out. And then in our cancer support community, this Cancer Transitions, where one can really sign up for, I believe it's a weekly program over 6 weeks for the recovery time, which is really, really great. It's sessions that are focused on survivorship skills and so forth. And then returning back to work through Cancer and Careers, some really nice pieces of information and so forth. If we go back to Oncolink, I did want to highlight that there are some just excellent blogs of all kinds. So I wanted to orient you just a little bit to their main website. You can see that there is sometimes blogs written by not only nurses, licensed social workers, but also patient advocates. And one that I really love is written by a nurse named Carolyn. And it describes here the 11 things to know about being a cancer survivor. And essentially right at the top describes this getting a survivorship care plan, or even through their website creating their own, which is just lovely. Many of the pieces that, again, I briefly discussed at the beginning. Treatment is over. Back to the grind, not so fast. You just went through months of treatment. Thinking about making sure that you're staying in touch with your primary care provider. There's a little bit also about this fear of recurrence and so forth. So some of the handouts from today that are available, we have here a very nice piece written by Penny DeCou, who is our licensed clinical social worker at the practice that I work at in Austin Central. And it is addressing a little bit about the fear of recurrence. Also, some other information is from the American Institute for Cancer Research related to Heal Well, healthy eating and activity for living. And then also is just some brief little pieces related to physical activity. When we create this care plan, there is going to be some additional information there for you as well, but I just briefly wanted to go over the attachments and the handouts. So let's jump right in. I have a volunteer as a case study survivor with us today. Mrs. Smith, are you there?
Yes.
Wonderful. So I'm going to highlight going on to the patient part of Oncolink. I am going to scroll over to the side here. We've got support. You can see that there's lots of information here related to cancer treatment, risk, and prevention. But we have survivorship, and then we also have a great link that says here, create the OncoLife Survivorship Care Plan. It will take you to the care planning program piece. And in the time that we've got, let's get started. We'll click Develop My Cancer Survivorship Care Plan. I hope that everyone can see my screen still. And it takes us really through steps 1 through 7 in a way. We're going to go ahead and complete the care plan version. I'm going to use the patient version. So it says here, would you prefer to use the patient version or healthcare professional version? At the end, I will show you there's very little difference when a healthcare provider creates it. But the patient version that is of focus today will ask at the end some side effects questions to see if we have any. So Ms. Smith, are you there?
Still here, yes.
Perfect. So if you can see my screen, the first part here on section 2 talks about demographics and asks about your gender. So I'll select female. And your race?
Caucasian.
Very good. Then we have here age at diagnosis.
Ooh, 51.
Okay, very good. Thank you for telling us your age. And then your current age. I know that
50.
I think go ahead.
Oh, 53. Sorry, no, 52. Haven't hit 53 yet.
Very good. And then it says here, what is your relationship to the patient? I'm going to say self because this is, again, the patient completing this. Mm-hmm. And which of the following have you been offered? So you could complete any of these, but I am going to select a survivorship care plan. Does that sound fair, Mrs. Smith?
Yes, it does.
Excellent. And as we get into a few personal questions from time to time, this next question says, is the survivor in menopause?
Yes, I am.
Thank you. And what is your geographical location in the United States?
I'm in Texas.
Excellent. So just to review, there are steps at the top of the page that it will walk us through. So we are completing the demographics part. And as we've scrolled down, then at the very bottom, there is a navy, deep, dark purple button that says Next. If you were ever going through this and you wanted to go back at any point in time, be sure to hit the previous button that's on the left side of the screen versus at the very top of your web browser. So show that. Section 3 asks about the cancer type. So tell us about the type of cancer that you had.
It was colon cancer.
Okay, I'll select that there. It says, do any of the following describe your situation? Are you living with metastatic disease? I have had a recurrence of a previous cancer, or no, neither of these describe my situation?
Neither.
Very good. It says here, would you like information for yourself or a friend or family about quitting smoking?
Oh, no, don't smoke.
Very good. And then it also describes here, would you like information about genetic risk or genetic testing?
I don't believe that applies to me from what I understand.
Very good. So yes, the Texas Oncology practices and sites across Texas do have the Genetic Risk and Evaluation Program, the GREAT program, which is generally offered by your physician and advanced practice provider very close to diagnosis if one does meet particular NCCN guidelines. So we'll click Next. So surgeries. What surgery did you have? Or surgeries did you have?
There was a resection.
Okay, so there was removal or of a section of the bowel, of your bowel?
Yes, exactly.
Okay. Click next.
And that was my
Then,
only one.
very good. In section number 5, it asks about chemotherapy and biologic therapies. So do you recall what anti-cancer medications you received?
I believe they call it 5-FU, Folfox.
Very good. Folfox, and so part of that is the 5-FU and the oxaliplatin. Excellent. And then did you have any radiation?
No, no radiation.
Very good. Hopefully for those of you who are viewing, you are seeing the ease, the simplicity, in a way, the speed. I am trying to go slowly through it for everyone, but much of it is where I want you to be able to view the screen, view the questions, and I just, as a healthcare provider, I love completing these for patients. I love teaching advanced practice providers and nurses how to complete these for patients. So it's, again, an honor to teach you all how you could create your own. We have here in the last section some side effects. Describes here a few questions. It says here, your answers to the following questions will be used to better understand the patient experience and to help us further develop the program. Which of the following have you been affected by or diagnosed with since your cancer diagnosis? So, it says here, Ms. Smith, have you experienced any sexual concerns at this time?
No, not at present.
Have you been diagnosed with osteoporosis or osteopenia?
No.
Have you been diagnosed with acute myeloid leukemia?
No.
Have you had any persistent numbness and tingling in your hands or feet?
Yes, I have.
Okay, peripheral neuropathy there. Have you had any chronic changes to your nails or your skin color? Oh, did we lose you?
Oh, I'm sorry. No chronic nail changes.
Okay. Are you experiencing any fatigue that would be overwhelming? So physical, mental, or emotional exhaustion at this time?
Now.
Okay.
During some of the, but now, no, I'm doing fairly well.
Very good. Glad to hear that. Have you been diagnosed with a hernia since your cancer surgery? Okay. And have you had any changes in your normal bowel patterns since your cancer surgery?
Again, at present, I'm doing fairly well.
Okay. And then have you been diagnosed with scarring or strictures of the bowel or any kind of bowel obstructions?
No, concrete.
Excellent. I'm so glad to hear that things are just coming along so well. It's wonderful. So as we've gone through, back to reiterate, steps 1 through 7, then right here at the very bottom, it does describe how, again, get your care plan. I'll review again the fact that if you ever needed to go back any steps, 1 through 7, just simply click the previous button here on the right-hand screen. So let's get your care plan. It takes a few moments.
It really is very straightforward.
Yeah. We have here then our summary, which is all nicely succinct and so forth. But what I want to highlight is, of course, the fact that by clicking here, download care plan, it will create a very nice PDF. If one likes to read things online, you can select the various options at the top here and read through those. But by clicking download the care plan, it populates upwards of 16 to 20 pages of information that is specific and personalized to you. As you can also see, Oncolife and Oncolink are managed by Penn Medicine. They have an extremely excellent team who, anytime I've ever written with any particular questions or needs, The responses have been very prompt. So as a cancer survivor, if you ever notice something that could be added or you liked something and so forth and you wanted to provide them with any particular feedback, please let them know. I think that if you are a cancer survivor who's completing this, you will also see this care plan feedback section, this survey, and I have a feeling that they would love to have any information that you could provide to them. Please utilize that. We have here then all kinds of sections. You could click on particular areas if you just wanted to jump to that information, but what I really like is it just definitely summarizes in 12 pages kind of everything that's important about coordinating your care. In each section, we have, of course, the medications, we have the surgery. I love how each section talks about what are some really important pieces about follow-up care. So any kind of early stage, these are some things that, again, your oncology care team will be talking to you about. And you will be seeing them usually every 3 months for the first few years. There may be some scans in the future as well. It talks about surgery side effects. So what are things to expect? Hopefully, again, if we've done this up to 6 to 9 weeks, up to 3 months post-treatment, meaning surgery, chemotherapies, immunotherapies, and so forth, I hope that things have continued to improve, symptoms have been well managed by your care team, and so forth, and that you have been talking with them throughout this whole journey to manage those symptoms as best as you can. I like how each section has also a takeaways piece. So just some of the basics, talking about using the healthiest types of fats here, plant sources such as olive oil, canola oil, including 5 to 7 servings of fruits and vegetables per day. Wanting you to again get good vitamins, good fiber, and so forth. So just basics. Then, based on some of the medications, the 5-FU, or sometimes we have hand-foot syndrome side effects, or the oxaliplatin, where we might have some neuropathy, some information about that neuropathy. Keeping your doc and your oncology care team up to date if that is continuing. It also just discusses the risk for developing osteoporosis, where you can work on, and that's part of, again, that visit and this information is what can I do right now? Well, am I taking 1,000 to 1,200 milligrams of calcium? Am I taking D3, vitamin D3 daily, and so forth? And then hopefully, maybe when you had a treatment review visit with your nurse or your advanced practice provider before you even began treatment, hopefully there may have been discussions about diet, exercise, and fluid intake and so forth. Maybe you were walking during that time, and now post-treatment you're wanting to consider some other additional pieces to your exercise and routine. I really like how it breaks down, trying to incorporate weight-bearing exercises, anything a few times a week. I'm a big believer in just walking, and for some people, some organizations locally offer Tai Chi or yoga. There's of course those centers that have quite usually an expense to it, but you also have community resource centers around. Here in Austin, I've been familiar with the Samaritan Center, where they have Tai Chi on Thursday afternoons for $10 and yoga on other afternoons and so forth. So there is a way to find it where it's tending to be at a reasonable amount. These would be the things that if you wanted more information about resources in your community, they're generally covered in a survivorship visit, but you could, of course, call that nurse that you know, that social worker that you know at your site that you've gotten to know over the last few months. You could check in with them about these things. Some are just basic exercise steps. It seems very simple, and I think that's always the best thing to do, is to start slow and just keep going. Maybe there's some skin changes that could take place. Also, for some chemotherapies, there is, of course, chemo brain, as it's referred to, where there are changes related to our cognitive, our short-term memory, sometimes multitasking, sometimes new learning, reading and comprehension, or just attention. If you're noticing things like that, letting your healthcare team know. In many cases, sometimes people begin to utilize Lumosity as a really great program to keep those neurons going and so forth. For some women, there can be sexuality concerns. It's the same for men. Again, chemotherapy and so forth, surgeries and so forth can really change some things. So in some cases, your social worker, your nurses, if you're needing additional assistance with any particular information, including just sex during cancer, sex after cancer, some people might even need to just check in with a sex therapist and so forth. They'll be able to provide you with that information, which is wonderful. Lots of resources in your communities. There will be the discussion of a risk for any kind of secondary cancer as well. So things to report if you're noticing these things going on at any point in time. Again, we're going to be holding your hand over the next 5 years. We're just not holding it as closely as we were during treatment. And then what I also love is, of course, just some healthy living pieces. Back to, again, the slides, health promotion. General cancer screening will be reviewed and so forth. We'll continue with mammograms. There will probably be, again, cervical cancer screenings and so forth. And in some areas, there's lung cancer screenings, making sure that you're staying in touch with your dermatologist, your primary care doc for a skin check every year. So I've just tried to show you, as we're kind of on page 9 of the 12, the basics that are here. Very clear. I love using this program every time because of that simplicity. And as you're reading through it at home, when you've created your own, again, I've repeated myself, but if something comes up and you wanted to know more information about it, bring it up to your oncology care team. Again, always making sure that you're seeing your dentists, and, of course, getting your eyes examined from time to time. I think lastly, they end on kind of fatigue, some of that basic information. One's body 3 months post-treatment should be improving, but everybody's body is different. I always describe to patients when I visit with them at any point in time that just as your personality is unique to you, the way that any of these treatments, any of these surgeries, anything comes together for you is just as unique. So there may be things that aren't, as common side effects, and you've experienced those talking with your oncology care team. And then life after cancer. I think, of course, during treatment, it's important to keep doing the things that add to your quality of life, whatever that may be. Most people, they notice that there's a change in their endurance level. So in general, maybe you're doing those little things throughout. If you did clear your calendar, if you did just kind of hunker down during cancer treatment, for sure, things are, there's this light at the end of the tunnel here, and I really want to make sure that you're getting back into the activities that you love doing. I enjoy asking people, tell me 3 things that make you happy or make you smile, and trying to make sure that they're doing that, again, during treatment and definitely afterwards. There's always some time of getting ourselves stronger and improving our endurance, but getting back out there and could be where you're getting involved with local cancer organizations or just something that you've always wanted to do. So there's some discussion in this about purpose and the psychosocial pieces. I do feel in all my years that psychosocial oncology, although it is something that your cancer centers do ask you at the beginning of treatment, I think you may have completed the supportive care screening questions because we're wanting to see if there's any particular distress that we can help with. For some during treatment, that's very minimal. But if it does come together, or if it does happen, it generally tends to happen after treatment has ended. So don't sit there being overwhelmed on your own. Please reach out to your oncology care team so that we can know, so that we can connect you to, be it a therapist or a counselor or support group, because it seems to be something that's very, very common. So we've gone through this piece. If you were to have completed this on your own at home, you could certainly print out all 12 pages again and take that to your oncology provider. Or if I scroll back up here, we're back to just right there before we clicked this download your care plan. You could also click download the healthcare provider summary. So then this is generally much shorter. And I highly recommend that you print off a copy of this and take it to your primary care doctor. You can see it's 3 pages. And that you could bring in this copy to your oncology provider if you like. So it says similar information, of course, but it's just very, very condensed. And it's so that they're aware of, in particular, like I said, your primary care doc, they're aware of things that you're going to be at risk for, or that you're having managed by your oncology provider, and so forth. If for some reason you were to do this with your healthcare provider, if you had a survivorship care plan visit at a Texas Oncology location, then a nurse practitioner, a PA, a CNS, or a nurse, a registered nurse might create it. I wanted to show you what a summary looks like from the healthcare provider. It's all very similar information. The only thing that is added is that we have added essentially a little bit about what we have talked about today. We have pretty succinct, when possible, your oncologic history spelled out. We also, of course, include the pieces: past medical history, past surgical history, family social history, genetic testing if that was recommended by those NCCN guidelines, screening recommendations, and of course the medical follow-up plan. So it gets right into the same information after that, but definitely it is something that I like to highlight as an opportunity for everybody. So looking at our time, I do want to try to get back into this. What happens next? I've said this as, bring it in. If you haven't done this, but you'd want one of these visits, let your oncology practice know. And I want to thank all the caregivers for everything that they do, and you're priceless. And now I think we go to some questions and answers. I've tried to be mindful and go fast, but not talk too fast. Kelly, are you there?
Sabrina?
Yes, I'm here. I can't hear anybody else. I just wanted to check.
That's okay. That's okay. I think we're I think Kelly might be having some technical difficulties, so I'm going to jump in. And I don't have the questions in front of me, but I had a few questions of my own. Can you just confirm or tell me, how do you, so one, how do I get this type of appointment with my provider? So is it a separate visit than my usual visit with my physician?
It can be, for sure, yes. So if you created your own at home and you wanted to review some of the questions that you had from it, you could definitely call in to your office and request a follow-up visit. It would simply be that. If the practice did not have a survivorship program at that time, then these are still questions that your physician, your advanced practice provider could answer. So yes, you could request a follow-up visit to talk about your survivorship care plan. That'd be great.
And then another question that we had is, how do you, if this is something that you do on your own, when you go to see your provider, how do you introduce this into the conversation with them?
Well, in terms of, go ahead.
Oh, just do we print it out and into the summary and take it in?
That would be my best advice. I really like when patients are reading things, if they are using OncoLife and they bring that in to talk about like particular sections that they have a focus on or that they've noticed something is going on, definitely bring that in, and that's, these visits, these follow-up appointments, granted, most of them are happening at 3, 6, and 9, and so forth a month, but if there was any time in between and you notice something, then calling your healthcare, your oncology care team, just as you did during treatment, to review those symptoms and to have a follow-up visit.
Awesome.
Okay. I did end up finding how to read some of these questions, so I could try to answer them if you'd like me to really quickly.
Yes, that'd be great. Thank you.
So one asks here, we have Rebecca, who asks if there was a fee to use the link, and at this time there isn't. So you should be able to access Oncolife, Oncolink, just as I showed you, and just follow those steps. It should be it's free, and it should be pretty easy to go through. I have somebody else who talks about they finished their treatment a year ago but never knew about the psychosocial support available. Is it too late? It is not. So please contact your Texas Oncology practice so that they can get you connected to somebody locally, be it, like I said, a therapist, counselor, support groups, and so forth. So please, please check in with them. And I'm trying to see here. Somebody else has written in that sometimes the cancer support communities in your area might even offer free Tai Chi, yoga, and other exercise programs. I also, from time to time, highlight the YMCA Livestrong program, which is excellent. There is Fit Steps also in different places in Texas as well. So, as your oncology care team, we are always looking for, listening, seeing what's out there. People in your communities are telling us about things that are great to recommend to others, other survivors and caregivers. So please reach out to your healthcare team. We're here for you. So we've loved all of the care that we give to you, and we value you and that care. So if there's something that's on your mind, let us know. And
awesome.
I think those are the questions that I'm seeing.
Well, Sabrina, it is always a treat listening to you and hearing your passion. So thank you for hosting us tonight. And thank you to everyone for joining this evening. Just a few quick reminders as we close this webinar. You do have the ability to click on the attachments, so please download those PDF handouts, print them out, keep them. You will also, when this webinar closes, you will receive a survey. It will pop up on your screen. Please, please, please take a minute to complete that survey. Your feedback is most helpful in terms of improving this and also thinking about other topics for the future. So again, we just appreciate you joining us. Sabrina, we are very thankful for you educating us, and we look forward to next month. Check out TexasOncologyFoundation.org to see the schedule for the monthly webinars as well as the symposiums that we have coming this fall. So thank you all for attending, and have a great week.
Thank you, and thank you to Ms. Smith. You all have a wonderful evening.
Thank you.
Bye-bye.
Bye.